Good afternoon and welcome to the Governmental Affairs first committee meeting of the year. We are a committee of 17. We have 8 here, and what I'd like to do before we get started is have Representative Brockway give us just a little devotion. What number are you? 19?
I didn't have a devotion prepared. Prayer okay?
Works very well.
Let's pray. Heavenly Father, we come before you at this time in our country. We pray for wisdom as we deal with this very important issue. Pray for your guidance and your understanding, and pray that you give us wisdom as we deal with this. In your name we pray. Amen.
Amen. Thank you, Representative Brockway. And I want to take a moment just to introduce all of our members. We have one new member, but just in case, we're going to go ahead and start with each member. Just if you will, tell us about who you are, what district you represent, maybe what counties if you'd like, and anything else. We're going to start down there with Representative Kidd.
Yes, ma'am. Thank you. Rusty Kidd in Milledgeville, Georgia, representing all of Baldwin County and the southern portion of Hancock County. I've had 3 elections, been here 3 years, and look forward to working with you, Madam Chairman.
Thank you very much. Ready, Barry? Representative Fleming, excuse me.
My name is 26.
Okay.
Yeah. My name is Barry Fleming. I represent District 121, which is Columbia County, and McDuffie County, which is suburbs of Augusta. And happy to be here working with the chairwoman.
Thank you. Representative Floyd?
Representative Floyd. I represent Gwinnett County, which includes parts of Tucker, Lilburn, and Norcross.
Thank you.
Good evening, Madam Chair. I am Representative Tyrone Brooks. I represent Atlanta and Fulton County. This is my 33rd year in the Georgia House.
The dean of the committee, for sure. Representative Hightower?
Dusty Hightower, representing for District 68, which encompasses mostly Carroll County and parts of Douglas County.
Thank you.
Hi, I'm Darlene Taylor. I represent District 173. I represent Thomas, Grady, and Decatur County.
I'm Amy Carter, and I represent Lowndes, Brooks, and Thomas counties. Next, 19.
Yeah, I'm Representative Buzz Brockway. I'm in my 3rd year, so I've got Representative Brooks says 30 years on me, but I represent parts of Gwinnett County, including Lawrenceville and Suwanee areas.
Representative Powell?
I'm Alan Powell from Hartwell, Georgia. Served on this committee a few years and used to chair this committee back in once upon a time. Pleasure to serve with you, Madam Chairman.
Thank you.
Representative Mark Hamilton, 24th District, changed the district number, Cumming and Forsyth County, and I remember when I used to chair this committee also. Thank you very much.
Representative Mosby.
Oh, it's on me? Okay. Hi, I'm Representative Alan Powell from Hartwell. And, been down here. Okay. I'm Representative Howard Mosby from the 83rd House District in DeKalb County. I've been down here 11 years.
Thank you.
I'm Mary Margaret Oliver from House District 82 from the middle of DeKalb County. I've been in and out around the Senate, the House, back and forth.
Thank you.
I'm John Meadows from the 5th District. I've been here 8 years, starting my 9th, and I'm having a real good time.
Glad to hear that. Now I need to introduce 3 others on the committee. Justin Leaf, here is my legislative aide. I have Craig Foster here to my left, who is the committee aide. And then we have Jeff Lanier in the back, who is our legislative counsel. So if you need any of us, here we are. Glad to be working with you and excited about the numbers of people here today. At this time, we need to adopt our rules for the committee. If you will, look in your folder. You'll find the House Committee on Governmental Affairs rules. And you will note that the only substantive change that we made was the quorum requirement. It's under number 1, actually. We changed it to 7 members for a quorum. If you will, please review those, and when someone's ready, make a motion. Okay, motion has been made and seconded. All those in favor say aye. Those opposed, like sign. All right, the rules pass. Thank you. And now we're going to move on. We have a bill before the committee, Senate Bill 24. You have it in your folder. Thank you. Gentlemen, are you ready? Proceed.
Lee, can you hear me? Yes.
I can.
Madam Chair, and I must say it's an honor saying Madam Chair for the first time on your first bill in your first committee as chairman. How about that? It's an honor. And committee members, bring to you Senate Bill 24. This is the Hospital Medicaid Financing Program Act. What SB 24 does is authorize the board of the Georgia Department of Community Health to establish or assess one or more provider payments on hospitals. What this does is it brings down $680 million to fund Medicaid for hospitals and the providers. Currently, it's assessed at 1.45%. There are stopgap measures in place to prevent the Department of Health from going over that percentage. They are through in an amendment that was put in at the Senate through the appropriation bill. The percent cannot change unless it's in the appropriation bill and it's noted. And each year in the appropriation bill there will be a note telling what the percentage is going to be and how much money that is, and that is under the legislature's control. Through the Administration Procedures Act, if a change is made, there's a notification process that takes place, and there's a 30-day comment period that will allow the legislature and the committees that are involved with this can be called and have a meeting, and they can actually stop this from happening. And then when we come back in the legislature comes back in, then we can take action on it at that time. The money goes through the Indigent Care Trust Fund, which is constitutionally established that the money can only be used to fund the Medicaid program. So there's been discussion that the excess monies will go through the general fund. They cannot, because this was established constitutionally. What this will do by letting DCH authorize this fee is allows much more flexibility to reacting to what the federal government does and the changes that are coming and may come with Medicaid. To me, that's the biggest issue that we have with this, is that it allows that flexibility where they can react, where if we're not in session and we can't react to it in a comfortable time period. We've got hospital support. All the hospitals are in support of this. And I'll let Charlie, if he would like to say some words too. He's already presented it a few times.
We had a similar crowd in our hearing in the Senate side, Madam Chair, but I'm sure it's because it's your first committee meeting. Just to amplify and reiterate what my partner said here, this program in the federal government runs for 19 different health care entities. In Georgia, we only participate in 2, and that is nursing homes and hospitals. In 2003, we immediately started this program for nursing homes at DCH. In other words, the functional way that we're proposing today was done from the beginning in 2003 at the Department of Community Health. 3 years ago, this body decided to do a direct levy. Our friends in Indiana did the same thing, and in 2009 they moved, for them it was the Department of Mental Health, they moved this function to their Department of Mental Health. 49 states counting Georgia participate in this federal program, and there is really a full spectrum. There are at least 5 who do it directly through a regulatory body, as we're proposing here. But there's a full spectrum of how it's done, and it's done differently across the states. The only state that does not participate, just for what it's worth, is Alaska. And if we are to strike oil on state lands, certainly I would look forward to funding ours through a trust fund of royalty money, just as much as you would. But there has been some discussion, and with trying to not be repetitive of what Representative Hatchett said about oversight, and I do want to just hit some of the critical points. There is a 5-year sunset. We shortened that provision from the original introduction of the bill. We, as a legislative body, maintain oversight over the Department of Community Health from a true budgetary standpoint. That is to say, we establish their operations budget. None of these monies would flow into that operations budget. Instead, they go into the State Indigent Care Trust Fund, which is a constitutionally protected trust fund. Those dollars are not subject to being rolled into the general fund. We have specific language in this statute which provides that no funds may lapse. That is to say, if funds are allocated into the DCH for use in this program and they're not spent within that fiscal year, sometimes in our budgetary processes those funds lapse back into the general fund. That cannot happen with these funds. All funds must stay in the trust fund. So DCH does not have the ability to expend these on general fund or general appropriations type measures. They can only expend them in accordance with the trust fund. That's how the system works. In fact, that's a requirement of the federal model that we participate in. I think that covers the bones of the bill, Madam Chair. We'd be welcome questions.
Certainly. Any questions? Yes, we have a question. Chairman Powell.
I understand that the Senate amended the original bill. Would you tell me where that amendment is found?
I will. Thank you, Mr. Chairman. And to note, I think it is worth noting that there was an amendment on the Senate side, and you'll see it on line 41. And this follows up on the oversight piece. The aggregate amount of any fees established and assessed pursuant to the subsection shall not exceed those percentages of net patient revenue set forth in General Appropriations Act. That's a lot of language, but essentially the intent of the amendment was to say that whatever we set in the general budget as the expected revenue from this program, DCH cannot establish a rate that would exceed that revenue. They could, in theory, establish a rate that would not meet that revenue. Of course, then they'd have a trouble meeting their allocation, but they cannot set a rate greater than.
So that does give us direct oversight.
I would say that it does, in that we are the ones who pass the general appropriations. Yes, sir.
Representative Oliver.
My questions are a little bit practical about the override. I'm looking at the provider payment definition in line 32, and then I'm looking at the reference to the Administrative Procedures Act on line 55. I would assume that all of the provider payments that the DCH sets now are now going to become under our authority to override under this language. And have we ever overridden under the existing APA any other provider payments from DCH?
I am not familiar with our having ever overridden provider payments.
I am correct. Am I correct that what you're doing is the override provisions are those that exist in the APA in relation to similarly to other state agencies? There's really no difference.
That's correct. This is a reiteration of existing state law. That is to say, as they pass rules to implement this act, then we would maintain oversight under the APA as it exists today.
And the timing of that, just pragmatically, because they're going to pass regulation when we're not in session, and I forgot the specific provision. Is it within the first few days of the ensuing session, or do you have to call a special session, or? Comment window from the issuance. The provider payment goes to the chairman of the committee, I think, under the APA. Jeff is nodding over there. So the chairman of the committee, that would be a public notification to the chairman, 30-day comment period, but when does the override happen? Not until the next session?
I believe, and legislative counsel can correct me, I believe that the committee can be convened out of session to consider the rule within that 30-day window.
But we've never done that as a practical matter. that I've been paying attention. Have we done it as a practical matter? Somebody's nodding. Whoever that is.
Yeah, I will defer to others who have greater knowledge than I. I suspect that the fact that we have that power may reflect the lack of need to do it. That is to say, the knowledge that we are able to oversee usually obviates the need for any action to be taken.
Representative Kidd.
Thank you, Madam Chairman. I'm going to vote for this, so don't take this as a negative question, please. The fees you're going to assess, taxes, fees, what do you want to call them, the fees you're going to assess, is that on the overall revenues of the hospital? Is it based on the bed charges? How does it play into the effect of radiological services or MRI services, et cetera?
Well, thank you, Representative, and thank you for your support in advance. It is a number that is called net patient revenue, and I am not a hospital administrator, so I'm not sure I could give you all the details of how that's calculated, but my limited understanding is that it's essentially a measure of patient revenue. That is to say, billings to patients. So it would be a net number based on those billings.
So all services a hospital renders lumped into one?
I believe that's correct.
All right, thank you.
Representative Lindsay.
Just to sort of clarify Representative Oliver's questions, underneath 5013.4, the committee has the authority to both file objections prior to the institution of the rule by the administrative commission, and also has the power to object and stay the action until the legislative session, at which time there's a certain limited time period for us to act to overturn the administrative act. It's under 5013.4.
Very helpful.
Yeah.
The notice to the chair is only to the chair. There's no, I'm trying to figure there's a public notice that start running dates, because I looked at this before and got messed up.
Public notices as part of the administrative act. In terms of any kind of rule, there are certain requirements for certain levels of public notice to the general public.
But the notice to the chair is
But there's also a specific notice that is sent specifically to the chair as well.
Okay, thank you.
Representative Taylor.
Thank you, Madam Chair. I just wanted to go over really the reason we're having to do this has to do with the loss of federal funds, money we're sending to Washington. In order for us to recoup that, we need to make this fix. Is that correct?
I would agree with that, yes. We're talking about, again, the program. We allocate around $235 million into the trust fund, and that brings $454 million federal dollars with it. The payments, because of the increased supplement that we have for hospital providers in Georgia as part of this program, come back to the hospital community in an amount roughly equivalent to what is paid in. Now, that's not to say each hospital gets the same amount, right, but then providers are basically get a share of the balance of that $450 million as part of our Medicaid supplement, and we would be it would increase our donor status if we were not participating in the program.
Thank you. I've heard from several of my hospitals, and they are very much in favor of this, so thank you.
Representative Mosby.
Thank you, Madam Chair. Thank you for this legislation. This bill expires, it's 2017, looks like. Under the Affordable Care Act, are the dollars going to shrink for the matching funds, and in the future years are we going to have a tax number that's astronomically high in order to make this work?
I'll take that. We're going to, if we have to fully comply with the Affordable Care Act, Representative, we are going to have taxes like we've never seen. That's irrespective of this bill. Yes, the bill sunsets and comes back for potential reauthorization in that time frame. However, in the meantime, there is a real possibility that these funds will terminate altogether. And that is, as Representative Hatchett indicated, one of the reasons why we like the flexibility provided by allowing DCH to terminate any fee immediately if the federal matching funds go away, because the purpose of the program ceases to the extent that the federal government terminates this program, which is a very real possibility.
So state will just have to raise taxes at that point in time?
Or adjust Medicaid otherwise. Ideally, we would be able to manage Medicaid as a, I'm sorry, Madam Chair, I'm going off topic here, but ideally we would manage Medicaid as a block grant in the same way that we do Peach Care, and we would get our federal dollars and be able to manage them by Georgia principles and by Georgia decision making, and provide more coverage, as we have done with Peach Care, than being under the burden of the federal regulatory scheme and Medicaid. That is not an option that's been made available to us at this point, but we would welcome it.
Chairman Hamilton.
Thank you, Madam Chair. And don't worry, Senator Bethel, I won't challenge your bill like you did my first bill when it was before you. So just consider this a very friendly question, okay? Matter of fact, you may want to have Representative Hatchett deal with this. So no, I'm just kidding. Seriously. We've all had constituents that have brought to our attention concerns about the bill and various things, and I know in my particular case, our hospitals have said, one in particular, they don't really like it, but they understand it, and that's what I've heard a lot of, and I would have to agree with that. I guess I've always told people, well, come up with a better solution, and to my estimation, I've yet to hear a, quote, better solution. So my question to you is, would you please describe to me in this committee what happens if we don't pass it? If there is no better solution that we can offer, what happens to Georgia? What happens to the hospitals? What happens to the Medicaid recipients? What happens to the providers should this body decide not to pass this legislation?
Thank you, Mr. Chairman, and thank you for your generosity. I learned things over the last 3 years, and I appreciate you reminding me of some of the things I've learned. A couple of things are worth noting. The first is that because Georgia accepted stimulus money in our Medicaid program, we are not able to adjust participation criteria until at least at the 2014 at the earliest. So there's nothing that we could do on that side of the equation, which means the only thing we can do in the face of reduced revenue in the program or reduced funds in the program is to reduce provider payments. We estimate a 20% reduction in payments to providers, and the best numbers that we're seeing, I've heard up to 20. I'm conservative by nature, and so I hear more often 10 to 15 rural hospitals in Georgia likely to close and cease offering services. That would necessarily place pressure on their neighboring hospital systems, because those Medicaid patients would be transported into other hospital systems around the state, which would put stress on those systems as well. That would clearly result in a decrease in not only access to service based on the closure, but the provision of services in Georgia. That is to say, hospitals, like any other business, forced to balance their budget, or at least try and make ends meet in the meantime, would have to decrease some services that they provide to Georgians. We don't see, if there was another option, I would be for it, but I do think this is.
Chair,
Certainly.
So if I might be able to summarize that, it's fair to say that in lack of a better solution, of which I've not heard of one, the end results of failing to pass this somebody might even use the term catastrophic throughout our medical community here in Georgia, as well as catastrophic to many of our lower income or people that rely on these services.
If someone said that, I would agree with them.
Any other questions by the members of the committee? Seeing none, it sounds like it's time for some public comments. Our first speaker who signed up is David Tatum with Children's Health Care. Yes, you may certainly speak there, and that one's there.
Thank you, ma'am. I'm David Tatum with Children's Healthcare of Atlanta, which is the entity formed in 1998 by the merger of Scottish Rite Children's Medical Center and Eggleston Children's Hospital. And we've gone from 2 sleepy little children's facilities back then to the largest pediatric delivery system in the United States right here in Atlanta. We also operate the Hugh Spalding Children's Facility for the Grady Health System. In 2008, we bought the Marcus Autism Center. We have 21 outpatient centers. We saw 326,000 individual children in our system last year, and 55% of those were covered by the Medicaid program. That's over 185,000 individual kids. And we have provided each of you, late last week, earlier this week, you should have gotten it, a data sheet that shows from your districts how many kids we saw at Children's and how many were Medicaid. And if this provider fee does not get extended, it will have a direct impact on our ability to continue to provide services to the children of Georgia and the children from your district. Right now, the revenue that we pick up from the provider fee, because we are 55% Medicaid, adds about $23 million to our revenues, but it still doesn't cover our cost of providing care to the Medicaid population. If this is extended, that will go away. The governor in his State of the State address was pretty direct. He said that he would have to cut Medicaid rates for hospitals by 20% if this was not passed. And at Children's, every percent rate cut is $4 million in lost revenue to us. So you take a 20% rate cut, that's $80 million, and $23 million we lose from the add-on, $103 million dip in revenue. We'll have to make some difficult decisions. Will we be able to still provide the level of care and the types of services that we currently offer the children of Georgia? Probably not. Will we be able to still have the same number of people working for us? And we employ over 8,500 folks. 3 years ago, we commissioned Georgia Tech to do an economic impact study, and they concluded we had the same economic impact to the state of Georgia, the Kia plant down in West Georgia, and we're already here. It would limit that. And would we be able to continue to fund the cutting-edge research that we do every day to try to save the lives of kids in Georgia and make them healthier? No, we would not. We appreciate your support of this and ask for your favorable consideration. I'll be glad to answer any questions.
And I thank you very much for my district, which is 4 hours away, had 923 total visits for the year, and 67% of those were Medicaid. So thank you very much for giving each of us those.
Just sit down, perhaps.
Any questions from the members for Mr. Tatum? Seeing none. Thank you, Mr. Tatum. Next up, we have Jimmy Lewis, Hometown Health.
Good afternoon, Madam Chairman. My name is Jimmy Lewis. I'm with Hometown Health. Hometown Health is an association of rural hospitals. We represent about 56 from corner to corner to corner, about 50,000 miles a year worth of travel where there are very few airports. I appreciate the opportunity to share with you some impacts in the state relative to not doing this bill. To your point, Mr. Chairman, I think your question is an extremely important point, because some of the impacts may be unintended or some that may not have been thought about were this bill not to pass. So I'll try to quantify some of those. To put into perspective, though, the bill is quite much more significant than a 20% cut. There are actually two parts to what would happen were this bill not to pass. There would be the 20% cut in the absence of the federal funding, but there would also be the reduction of the current 11.88% add-on. So for those hospitals that are true Medicaid, high Medicaid volume providers, they would actually receive a 32% cut in their Medicaid rates. Now, there are a lot of quality issues that will go with this, and I'm not going to speak to the quality side. I'll leave that to clinical people to do that. But I'll share at the end one of the major impacts that will be on quality, and you'll see where I'm coming from. To run in the numbers on what this bill would do, one can make the case that were it not to pass, we could have the loss of up to 25 to 27 rural hospitals due to the inability to fund them through their Medicaid programs. Now, were that to occur in the rural side of Georgia, Healthcare access being important that it is, we would probably disrupt access to 450,000 Georgians who, because their hospitals will have closed, and who had proximity to health care up to that point, would lose that proximity. And by having lost that proximity, access could go from 10, 15 miles to 60 to 80 miles. And that's a significant loss of access. There's another problem that's going on in the state relative to access, and it was pointed out yesterday in one of the news journals, and that is, to date, we have had significant loss of OB access in the state of Georgia. Currently, we have 34 critical access hospitals. 32 of them no longer deliver babies. The next level up hospital is called a PPS hospital, and that's usually something under 22 or 24 million. We've already had 8 to 10 of those to drop the OB program, and there are currently another 8 to 10 that are in jeopardy. Were this bill not to pass, then we would certainly see in the state of Georgia, in the rural side of the house, a minimum of 50 hospitals who do not deliver babies. And that's a major impact to the well-being and the care of the rural Georgians. There's another unintended consequence to this should it not pass, and that is, because these hospitals are closing, they're the economic engines in these communities. They typically employ 150 or so people, and then there are the ancillary employments that go with it. And when these hospitals close, that employment base is lost. We're currently experiencing one of those even as we speak, and that is in Arlington, Georgia, where last Monday we laid off 29 of the remaining employment base for the hospital. And in all probability, we'll have to lay off the next 25 or 30 within 10 days, and that'll be a hospital that's closed, and that means that that community of Arlington, Georgia, and Calhoun County will lose upwards of 100 people who have been employed and have paid taxes. Now, the consequence of that is, with 27 hospitals, if indeed that were the number that's lost, we will create catastrophic results on the tax digest of 27 counties. That's a major problem that comes back up to the state more at the macro level. Because of the employment in these hospitals being what it is, were we to lose those 27, we would lose about 4,500 to 5,000 employees. They would go on the unemployment rolls, and the ancillary unemployment would go up another 4,500. We'd stand to gain 9,000 people on the unemployment rolls. The payer mixes in these small communities are about 50% Medicare, 20% Medicaid, 12% self-pay, and the rest is commercial. Were these hospitals to close, not only do we impact the healthcare access to the Medicaid patients, but we also tremendously impact the Medicare recipients and those people who are indigent and self-paid, and then the commercial aspect as well. So it's a compound problem with respect to that access. As indicated, Calhoun down in Arlington is currently in the process of closing. They've already laid off the first 29. They're liquidating their assets. They liquidated a nursing home, liquidated an assisted living facility. And that's, if you want to see an example, that's the example of how they will occur when they close. It's a catastrophic situation. I spent many nights at midnight on the phone with their county commission chairman and their board chairman trying to discussing how to deal with this issue. And it's an untenable issue to deal with. It leaves them in a very major problem. So the consequences of not doing this will truly be catastrophic to the economic well-being of rural Georgia, where over 50 to 60% of the geography of Georgia will not have access. Access to health care will be defined as something close to 60 to 80 miles to get to it, and that's where we are. So I appreciate the opportunity to share with you a few of these thoughts, to address, Mr. Chairman, your specific question, and to remind you of the need for this bill to absolutely pass.
Thank you. Any questions? Ethan James, Georgia Hospital Association.
Good afternoon.
Good afternoon.
Thank you, Madam Chair, members of the committee. My name is Ethan James. I'm with the Georgia Hospital Association. The Georgia Hospital Association represents more than 175 hospitals here in Georgia, from our small 25-bed critical access hospitals all the way up to our large urban multi-hospital health systems. Our member hospitals employ more than 158,000 healthcare professionals, and we certainly appreciate Senator Bethel and Representative Hatchett's hard work on this legislation. Just a few brief points, and again, I will be brief so as not to be redundant. GHA is proud to stand in support of SB 24. I would like to mention again, this has been mentioned earlier, the unity amongst the hospital community, the Georgia Hospital Association, the Alliance of Community Hospitals, and Hometown Health. We're proud to work for more than a year with the Governor's Office on this legislation, and we stand in unified support of it. Again, the Representative Hatchett pointed to the flexibility that this legislation would offer both the state and the hospital community as we move forward with continuous changes in the healthcare environment, both with commercial insurance and the Medicaid managed care roles, as those roles continue to expand and contract, as well as changes from the federal government. This is important that we have this flexibility as we move forward. And finally, of course, the ramifications of not passing this legislation, again, would be catastrophic. Some folks have focused just on the effect on the Medicaid recipients, but when a hospital closes or a hospital has to lay off employees or close service lines, that affects all healthcare patients for those hospitals. With that, Madam Chair, again, we stand in support of SB 24, and I'd be happy to try to answer any questions.
Thank you. Any questions? Thank you. Julie Wyndham, Georgia Association of Community Hospitals.
Thank you, Madam Chair. Good afternoon, members of the committee. My name is Julie Wyndham, Vice President of the Georgia Alliance of Community Hospitals. As the voice of Georgia's not-for-profit hospitals, we thank you for the opportunity to speak with you today. We would also like to thank the Governor's Office and House leadership, including the Chair and the sponsor of the bill, for all their hard work on this important issue. Like many industries, the state's community hospitals have faced tough economic times the past few years. And while we would prefer that the state's revenues were sufficient to provide adequate funding for Medicaid providers, that unfortunately is not the case. Therefore, we ask that you support Senate Bill 24 to allow the current Medicaid financing program to continue. This program is a partnership between the state and the hospital industry that allows Georgia to pour down federal funds to ensure that Medicaid rates for all providers remain at their current levels, while also letting the state avoid cutting other areas of the budget, such as economic development and education. But most importantly, this program ensures that Georgia's most vulnerable citizens continue to have access to much-needed medical care. Without this partnership, physicians, dentists, nursing homes, and all of the providers potentially face up to a 6% cut in reimbursement rates. In the alternative, if only hospital rates are cut, we face up to a 32% decrease in funding with the cuts and loss of the add-on from this program. Let me put that in dollars and cents. We currently receive roughly 85 to 90 cents for each dollar we spend to treat a Medicaid patient. If we are forced to absorb this cut, we would only receive about 65 to 70 cents on the dollar of cost, not charges, cost. We cannot sustain such drastic cuts in these difficult economic times. Cuts of that magnitude will mean cuts in services to all patients, not just Medicaid patients. In addition, cuts of 32% will likely result in jobs being eliminated by hospitals and health systems. This would be devastating, particularly in those counties where the hospital is the largest employer. And finally, to answer Representative Oliver's question, you used your APA oversight, I believe it was in 2007, to override a rule DCH issued that was related to general surgery ASCs. You came back the next session and then passed comprehensive CON reform. And I can assure all of you that we will be watching and we will let you know if DCH is not following your directions. I'll be happy to answer any questions.
Thank you, Ms. Wyndham. Any questions? Okay,
thank you, Madam Chair.
Matthew Hicks with Grady Health System.
Good afternoon. We believe Georgia can't live without Grady. 1 in 4 doctors working in the state train at Grady, and we serve patients from every single county each year. As the largest safety net institution in the Southeast, we do ask for your support for Senate Bill 24. We consider this to be a critical access to care program that supports providers that see Medicaid patients. Approximately 30% of our payer mix are Georgians on Medicaid, and another 30% are uninsured Georgians. Without the Medicaid financing program, Grady would lose approximately $36 million in revenue. That includes the reimbursement rate cuts that would necessarily follow. Not only would this make providing the same level of charity care we provide today impossible, it would threaten the health system's financial stability, which we've been working so hard to achieve the last few years. So we ask for your support. Thank you.
Thank you. Any questions? Thank you, Mr. Hicks. Scott Maxwell, Memorial Health.
Thank you, Madam Chair. I'm Scott Maxwell, represent Memorial Health down in Savannah, and I'll be very brief. The points have been made. I will say that Memorial plays the role of Grady down on the coast. It also plays the role of CHOA down on the coast with a children's hospital. It has a level 1 trauma center. Jimmy Lewis made the point of many rural hospitals would be endangered. If some of those hospitals in deep southeast Georgia go under, those patients will go to the tertiary center, Memorial Health in Savannah. This bill is very, very important to Memorial. We'd very much appreciate your support of it. Thank you.
Any questions? Thank you, Mr. Maxwell. Anyone else from the audience interested in speaking? Is it Patty? Ms. Benton?
Good afternoon, Madam Chairman. I'm Patty Bentley, representing House District 139, which includes Taylor County, Macon County, Dooley County, and the city of Fort Valley. And I just kind of want to echo what Mr. Lewis mentioned about rural counties, representing Taylor County, where there's 9,000 people, only 1 doctor, and no hospital. We definitely need this bill to be passed for the people of rural Georgia. Thank you.
Thank you. Anyone else? Okay, gentlemen, would you like to make any closing comments? Thank you.
Thanks, Charlie. Put me on the spot here. No, we would just like, we thank the committee for the time that they've put into this and looking at this, and the great questions that have been asked, and thanks to the hospital community for coming out and supporting this bill. They've been behind it for a long time and been working on a long time, as has the administration. And we would appreciate your favorable support.
Senator, anything else?
Thank you, Madam Chair.
Thank you. Representative Powell.
Madam Chair, at the proper time, I'd like to make a motion.
It's proper time.
Madam Chair, I move that this committee adopt Senate Bill 24 as presented with a due pass recommendation.
Thank you. Representative Brooks.
Madam Chair, I'm honored to second this bill. Motion. Thank you.
Thank you very much. All right. Well, we have a motion to do pass Senate Bill 24 and a second. Any other discussion? All right. All those in favor say aye. Aye. Any opposed? Same sign. All right. The measure moves forward to the Rules Committee. At this time, I want to just ask the few members who came in after we did introductions to please introduce themselves. We'll start with Representative Williamson. You're saying your name, what district you represent.
Sorry, Bruce Williamson, House District 115, Walton County.
Very good, thank you. And who else down here? Jay Powell, excuse me, Representative Powell, Chairman Powell.
Jay Powell, District 171, which is all of Mitchell County and half of Colquitt County and half of Decatur County.
Thank you. Representative Lindsay.
Thank you, Madam Chair. I am an ex officio member of this committee and represent the North Atlanta neighborhoods in Buckhead.
Called Brookhaven.
From Brookhaven to Atlanta Memorial Park.
Leader O'Neill.
Madam Chairman, Larry O'Neill. I represent District 146.
Thank you very much. And I do want to mention that your subcommittee assignments are in your folder if you'd like to review those. And at this time, the meeting is adjourned.